I have got quite a bit of content to present to you so that you hopefully get a bit of a flavour of what some of our local care partnerships are working on now. We will try and keep that to round about 45 minutes, just so that there is some time at the end if you've got any questions to ask. But if we run over, or if you need to shoot off, or you don't have time to ask the question that you wanted to ask because there's a whole ton of them come in, then do feel free to reach out to us after the session to ask for a bit more information as well, and that's also absolutely fine. Just find the slides. Okay, hopefully they are up for everybody now.
Yeah, that's great. Thanks, Kim.
Thanks, Rachel. Okay, so the first ones, if you are connected with a local care partnership, then the first few slides are going to seem really familiar to you, but we don't want to assume that everybody that's dialed in today is already really connected in with local care partnerships. So we're just going to do a whistle-stop tour of what those local care partnerships are. So local care partnerships is the way in Leeds that we bring together health and care partners with third sector, community groups, other bits of the council on local footprints. They're based around the primary care network's boundaries, roughly. So that's the way that the GP practices group themselves together. And it's a way of bringing a really broad cross-section of partners together in a place to look at not just what are the health needs of that population, but what are the things that are impacting on the wider determinants of health. A little bit further into the presentation, I'm going to talk very briefly about neighbourhood health, which is part of the national strategy, part of the government's 10-year plan for the National Health Service. But if that's already familiar to you and you're thinking, where does all of this fit with that neighbourhood health piece? Well, that's going to be coming up in a little bit. But kind of with where we're at now and local care partnerships, we would say that broadly, these are the activities that local care partnerships tend to be engaged in. We have some public facing events that happen under local care partnership umbrella that bring a range of partners together, doing things to reach the public, again, around that kind of broad health and wellbeing type activity. So some of those might be really niche and focused. So we do the student wellbeing weeks. We tend to do fairs there, particularly in the first term for students with Leeds Student Medical. A number of our more outer areas, or those with older populations, do very specific dementia information events, but we also have some wider health and wellbeing events that happen through the year. We also offer staff events and shared learning. Some of those happen very specifically within certain local care partnerships. There's a piece going on in Hatch at the minute around food and raising people's confidence around having conversations relating to food. But we also have regular learning forums that bring all of our different local care partnership partners from across the city together, often shaped around things that we're seeing coming up frequently as topics in individual local care partnerships. We've got a number of local priorities that will be generated by the partners in the room. So what are the things that they want to work on together? And some of those might be campaign focus type things, so things like stop smoking or increasing uptake of breastfeeding. Other ones might be really targeted approaches around particular challenges and issues that partners are seeing. And then we've got a number of Leeds priorities that we have been asked to look at in particular local care partnerships, because the data within the city has highlighted that those are particular issues in that area and that we want to have a real focus down there, and a local care partnership is the right way to do that. But then that kind of section of the pie that is jutted out slightly on this slide, the relationships and networking. If you come along and you engage in local care partnership meetings, then that is a large part of what you can expect there, that one of the key roles of local care partnerships is a way to connect you with the other people that are working in an area. So if you cover a local footprint, it is a way for you to connect with and form stronger relationships with a whole range of partners that are actually working on that patch. If you've got a broader remit, if you're covering right across the city and you've got a piece of work where, again, you're wanting to make sure you've got connections in certain areas, then those meetings are just a really good way of brokering some of those relationships. And you can reach out to any of our team should you want help and support in doing that. I'm going to hand it over to Rachel for the next handful of slides.
Hi everyone, I hope you're doing well. So you may remember that we've had various iterations of a dashboard or summary of activities that we've sent out over the years. Well, we've now arrived at a dashboard that we're circulating on a quarterly basis, which really sort of details by each LCP, a summary of activities, and then a forward look at the activities that are coming up in the upcoming quarter. So the main aim of sharing it is so that partners who are looking to directly engage within an LCP can see what it is that they can really get involved with in that upcoming quarter. But it also lets you know who in our team to contact. So if you'd like to get involved, and you can see there's a working group perhaps, and you've got an interest in that area of focus, you can join up with that and really positively contribute. And so taking our learning from the last time we did a dashboard approach, we're really trying to keep the tool very simple and focused, rather than a catch-all for everything that we know that is going on within an LCP. So it won't detail absolutely everything you know is happening in your area, but please don't worry, that activity is still really valid and valuable. It also gives you a chance to see what else is happening across other LCPs that you might wish to learn from, or something that you might like to bring back into your LCP. So if you're on our mailing list already, you'll get a copy, but please feel free to share that with other colleagues as well. And as a team, we're always keen to take a learning mindset, so we're always happy for feedback on this tool as well. Next slide, please. So a bit of a reminder here of the LCP development team. So a small team that includes super helpful input from Forum Central, really to ensure input from third sector colleagues is strong, with third sector colleagues being such a core part of LCPs and neighbourhood working. So these are some of the activities that you can expect from us day in, day out. And due to our different roles, you may see more of us performing some of these tasks. So spanning from shaping LCP priorities all the way through to our project leaders who provide that hands-on project support. Our work is mainly around facilitation and support for LCPs. So we work at the speed and capacity of the breadth of local partners within LCPs. So probably just reflecting, even if we were a much bigger team, we would still move forward at the pace of our LCPs and what feels right and achievable to partners. They own the LCP and the pace that it works at. Next slide, thanks. So we want to showcase some of the developments within LCPs over the last quarter. I'm sure many of you have seen this slide before, but a bit of a reminder of the Healthy Leads plan and the areas of focus sort of over the past year, and this has guided some of the work within some of our LCPs. So just a reminder here that we're doing that really targeted work for people living within IMD Decile 1, so the 10% most deprived areas. And it's all about using data to identify target LCPs to work with, but then adding in that very local insight and that knowledge from LCP partners and communities to really understand what are some of the local issues, and then really importantly, what are we going to do together to address these? And really LCPs are about looking at that practical change on the ground in neighbourhoods. So one of the areas that was identified through this work was that people at the end of life were going into hospital for respiratory disease. So we've been working through the design phase in Crossgates and Seacroft, so identifying a really small cohort of people to work with. And I think on the next slide, there's a methodology of how the data is actually sort of drilled down and how we sort of get to that cohort. But again, we would sort of start with the data, and then LCPs would complement this with what does this mean in practice. So on the next slide, there's sort of the vision statement that partners came up with. So that notion of home sweet home, and probably just helpful to say home first is a big feature of neighbourhood health model and really providing that care closer to home. So the next slide is a bit of a model that was developed by all LCP partners within those two areas, and it's been reframed to be sort of renamed advanced respiratory disease and proactive planning. So this piece of work is part of the proactive family of work across the system. But the ethos that was important to LCPs is highlighted on the left-hand side, but really about providing that right care in the right place at the right time. I won't go into the model in too much detail, but really at the start of the model, we're really looking to enhance care coordination. So having somebody who can have that relationship with the person and their family and really adopt that surveillance role. So work with them, connect their care, be that point of contact during core hours, find out what really matters to that person and their family, appreciating the wider determinants of health also. And it's about working with that wealth of partners in an MDT approach, in a network team approach, but also that's including third sector partners, really looking at how we monitor and respond to needs. We found through the diagnostic phase some of the reasons why people ended up in unplanned care and in hospital was down to experiencing breathlessness and anxiety. So we've got a fantastic offer from St Gemma's Hospice and also Leeds Mental Wellbeing Service to offer people and their family members, but it's all about self-management techniques. And that's going to be a mixture of in-person and online sessions, but also exploring how do we deliver that in community settings. So going to places that are closer to people and where they have trust and familiarity. We know that 60% of admissions from this population was taking place out of hours. So we're testing out providing people with access to a support line. So that's 6 p.m. to 8 a.m. and then throughout the weekends. And that really sort of builds on the existing telecare service that's already in place in the council. And that's about people and families can call that line when they're starting to worry if something isn't feeling right. Actually, they've got a point of contact to reach out to, and they'll take care of the rest in terms of signposting or what response that is appropriate. So yeah, really looking forward to getting some good learning from this initiative. Next slide, please. So really proud to share the hard work of the partners has come to fruition and this work is now live. So we've got local people now who are benefiting from this enhanced model. So we're 8 weeks into the testing phase of the model. And really, we've got 14 patients, 14 people who've been on board to the project. And we're taking a real test and learn approach. So looking at how things are working. So what are the strengths, where things might need changing, but making those changes rapidly. So this is not a piece of work that you test something out for many, many months and then you evaluate. We're looking at making changes rapidly, informed by what we're seeing and what we're hearing. Some of the feedback from partners is that it's much easier now to get specialist advice from partners. For example, local partners have got great access now to the respiratory team. And in that short space of time, they've already built really good, trusted relationships. They can pick up the phone to each other and have a chat and get some advice. And then really interesting feedback around the importance of the wider determinants of health. So some of the examples of the support people now have in place. So heating on prescriptions been provided to some of the families. An attendance allowance application has been completed and also granted. We've had some grab rails and additional banisters prescribed and installed by Fantastic Care and Repair. And then there's a blue badge application. So just looking at some of those social determinants of health as well and really looking at what's important to those families living in Crossgates and Seacroft. Oh, this is like such an exciting development. So I'm really pleased to tell you about this. So this is some exciting work happening in Seacroft. It's brokered by the We Are Seacroft Alliance. So that's the local community anchor network via LS14 Trust. And we've established a community health panel. So that's a think tank for community-led research and consultation as a core part of the LCP. So we've got local residents who are working with the Local Care Partnership to undertake engagement and community-led research, but also involved in co-creating solutions. So we're already looking at some of the system and LCP priorities alongside this group. So there's 14 residents so far, and they're all really well connected. So they've got experience of navigating the health and care system themselves. We know these people are passionate about making a difference. We also know these local people are so well connected. So each of these 14 people have a reach of another 40 to 50 other families that they know. So they're really going to be representing the views of their friends and neighbours in this work. It builds on the history of 5 years plus of LCP working with the community in this area. So we've got that maturity of trust and those shared values already in place. And the mission is really wanting to ensure that health and care strategies are really informed by the community, and people really are at the heart of LCPs. So these people are working with us on existing priorities, but will really be key to informing priorities going forward. So really looking at what is important to residents in terms of living well and thriving in their neighbourhood. So on this slide, just describe some of the outputs in terms of also increasing community capacity, skill building, leadership, but also looking, could this be a scalable model for integrating local voices into healthcare planning? Is this something that we could roll out in other areas? And I think what's particularly unique about this work is we're trying to now pay in those local residents, those local people for their time. So really acknowledging their expertise and that people really are an equal partner in LCPs and an equal partner in neighbourhood health. And probably just want to say on that bit as well, would the LCP in Seacroft and surrounding areas would like to move to having local citizen reps as part of their leadership group. In a way that works for them. And again, it's a test and learn work. So look forward to sharing with you in the next what's happening in LCPs, how far that's got. And then this slide is a little bit of a reminder of the Healthy Leads Plan priorities that some of the LCPs have been working on over the past year. So you might see some of the neighbourhoods that you're involved with, you might be in some of these LCPs, or it might be that you'd like to learn a little bit more about what they've been doing, and yeah, really happy to join you up and tell you a bit more about those within this session, but also outside as well.
So back to me now for a little bit, and I'm going to talk about a couple of things that have been going on in the York Road Local Care Partnership. So the first thing that I want to talk through is the non-clinical multidisciplinary team working within that partnership. So this is a partnership that's really been founded on very strong relationships between partners. It was kind of a brand new area 5 years-ish ago when we were starting to work on local care partnerships, and one of the things that they really wanted to do as a partnership was build those strong connections along the York Road corridor between all partners. Kind of fast forward to round about this time last year, and in conversation in one of our local care partnership meetings, the social prescribers that work within Linking Leads and those that work within the primary care network were both observing that they were seeing quite a lot of issues around housing concerns, around financial inclusion, and also some of the lower level mental health issues that maybe people don't qualify for certain mental health services, other services might not be appropriate for them, but that they were really struggling with their mental health. And these were the things that they were spending a particularly large amount of time really trying to navigate. So as a group, we looked at, is there a better way of doing some of that? And what would really great look like if we were all trying to work effectively together as a single multidisciplinary team on those non-clinical issues, in the same way as we have those aspirations for clinical teams to be working in a really networked way. So some of the work that Rachel's just been describing in Seacroft is absolutely holistic, but at the centre of that is really great care coordination and clinical join up for people. This is kind of coming at it from the other angle really, and saying, well, what does it look like if all of those services that are supporting people with non-clinical challenges and issues are working really effectively together? We pulled out a number of different areas that we thought that partners could work on. But the one that partners decided that they wanted to start with was a non-clinical multidisciplinary team meeting. So the idea of that would be that partners would come together. There would be maybe 2 or 3 cases tops that would be brought along to a session that people could talk through, and everyone will bring their own different perspectives to those cases, and between us be better placed to be able to then support those individuals. Quite quickly, partners actually decided that maybe having those cases wasn't the bit that was needed as the focus. So they really appreciated the opportunity to get together and chat to one another, to really properly understand what each other's roles were, how best to use other services in the area. But actually, because the starting point was really strong relationships, people weren't actually waiting for a meeting to bring cases for discussion. They were already getting in touch with people and having chats. So what the non-clinical MDT started out as, and where it's kind of ended up, has been a bit of a progression. But what we have seen is those relationships that were already strong, really flourishing, people really appreciating that chance to connect and be able to discuss challenges and things that they are seeing. And then it's also had a number of different spin-off things. So safeguarding was one of those things that was highlighted as people didn't understand necessarily when they put in something that they think is a safeguarding concern, and it's maybe flagged as actually this doesn't need any further action. Well, how was that decision made? What actually happens behind the scenes? So as a result of that, the safeguarding and risk manager from the local area from Adult Social Care came and did a session with partners within the local care partnership so that they could really understand that bit of the process that happens after they've pushed something through, so that they understand that it's still really important to be flagging things, and just because there's no further action doesn't mean that there hasn't been things that have been happening in the background to make sure people are properly supported. Likewise, with housing, the primary care network team felt that they struggled with navigating and knowing exactly what to expect from housing, and felt like sometimes they were getting conflicting messages on what to expect. So the local housing manager came and did some work with primary care network staff so that they could better understand how to navigate the system, what things to flag, and also just understand the pressures much more that housing are under. So lots of kind of examples like that that are very hard to capture in terms of kind of hard numbers and impact, but in terms of partners feeling that they're really effectively working together to support people, it's been a great piece of work for that. That kind of piece is still evolving and continuing. We've not yet come back and revisited some of the other options and issues that they wanted to look at. So there's still plenty of mileage to go, but we're already thinking about how do we make sure that that learning is shared across our other local care partnerships. So we are aware that in other areas there are similar things happening. We're not looking to necessarily just take this model that worked for York Road and replicate it elsewhere, but we are looking at how can the local care partnership make sure that people have got the connections they need and can maybe strengthen some of the things that are already happening. So as you'll see at the bottom, Ruth in my team has written up a really full case study about this that does way more justice than I can in just kind of covering this rapidly as part of this presentation. We are looking to get that one live on our website, but in the meantime, if anybody's really interested, wants a copy of that, if you email either our Bucket account or Ruth, we can get that to you. So then the other piece of work that York Road are focusing down on has also come of that Healthy Leads Plan work. So where Seacroft and Crossgates were focusing on advanced respiratory, in York Road, one of the things that was highlighted as a particular challenge was their frail population tended to fall, with it resulting in a fracture more often than some of the other local care partnership areas. So as with the advanced respiratory, we took the data, we looked at that local insight of what might be going on, and we kind of looked at what are the things that would make a difference and got a local vision statement that resonated with those partners. So in terms of the information that we got a whole raft of data presented through that had been pulled off systems, but this slide just kind of summarises in a way that means something to people. Well, what actually does that mean for York Road? Why should we be concerned that people in York Road are falling, and where should we focus? So you can see from this slide things like there are more people with dementia that are falling than those people that don't have dementia. Telecare, which can be really helpful in terms of if somebody has fallen down, has a lower take up in this area than it does in some other areas, and is there something that we can do to encourage take up with that? One of the really key ones, and this fits with where we're at now with the Falls Prevention Hub idea, is that people in the York Road area were much less likely to take up strength and balance, which is delivered by active leads than in other areas, and much more likely to drop out of that strength and balance. And one of the things that was flagged by partners consistently was that transport was a real issue and a barrier to that. So we've just been working up over the past couple of meetings what a York Road Falls hub might look like, and where we're currently at is starting with that strength and balance. So we're busy identifying a suitable venue for strength and balance classes to take place, but that strength and balance will have transport provided for those that need it. So we're really testing out, if we have transport as part of that offer, does that encourage better take up and more people that are sticking with it? We also know from things like the self-management hubs that Leeds Community Healthcare have been delivering in partnership with neighbourhood networks and the Enhance scheme, that if you've got social support and other activities going on alongside that health support, then again, that can be an encouragement for people coming into hubs and engaging with things. But also in terms of issues like social isolation, it means that we are able to then encourage people to connect with activities that they may otherwise not have done, make friends, and just be more engaged and active within the local community. So we're looking at how we can do some similar things around that strength and balance. We're exploring whether we can provide food as part of that experience and day, so that people can share food again with peers, get to know each other, but also that gives professionals an opportunity to check in with them. And we're then also thinking about what are aligned services that might find it helpful to do some of their assessments or checks alongside this kind of hub offer. So very much a work in progress right now. And if this is an area of interest to you, then please do get in touch with us, because we are just building it in York Road, and we're likely to be mirroring and doing things similarly, certainly in Armley, which is the other area where Falls is a real focus, but again, looking to roll it out across the city. I'm now going to move us on to the south and west of the city. We've been spending a little while in east today in terms of some of the things we've been talking through, but there's been plenty happening in our other local care partnerships as well. So you might remember, if you joined us at the last What's Happening in LCP session, that was just before the Christmas break. It was right near the end of December. And there was a really last minute piece of activity in partnership with Public Health, where they had a little bit of one-off money needed to be spent by the end of March that they were using to try and do a blood pressure awareness project in the south and the west of the city. So there were a high prevalence of risk factors in the Armley, Inner South and Bramley-Wortley Middleton local care partnership. Those were therefore the areas that were targeted, and organisations could bid for small grants up to £5,000, but they could go for under 1,000 if they wanted. And for different levels of grants, there were different levels of checks that needed to happen in terms of number of blood pressure checks done. We had a really great response to that. It was a very quick turnaround. I think it was about a fortnight from identifying that there was the money there to putting together a webinar for people to come and find out more, to them actually expressing an interest. And they had to attend training in the January, right at the beginning of January, which coincided with all of the snow. So what was going to be a nice practical testing in person ended up with an online Teams session for everyone. But we had to fit it in so that we could make sure that all the activity was delivered in that first quarter. And we had a really good breadth of organisations. If you're kind of looking down the list and thinking it tilts a lot towards Inner South, one of the Armley bids was actually a number of partners working together across the Armley patch. So it was a collaborative bid that went in on the Armley piece. There were some key target populations in terms of those that were underrepresented for hypertension, and one of the aspects of the bid was people saying how they were going to target some of those populations. And the project aims were both to raise awareness of the importance of knowing your numbers in terms of blood pressure and how your blood pressure can affect your health, and then also to encourage people to have their blood pressure read. And as part of the public health training, there was really clear guidance given to the participating organisations of what to do if somebody's blood pressure was high, because one of the concerns from primary care was that they wouldn't be able to cope, as there was lots of people with high but not dangerously high blood pressure referred their way. So we had a pharmacy first approach with this one, making sure that we encouraged people along the right part of the pathway. There were a whole range of different activities that different partners undertook. A lot of partners delivered it within, if they had their own community centres, they delivered it within their community centres. And the reports from those particular sessions was that take-up was really high because there were already those trusted relationships, and that pretty much everybody was happy to have their blood pressure taken. It was really only those people who felt that they were already on blood pressure medication, having supervision, and didn't need their blood pressure check-in that had kind of declined. But most other people were absolutely up for it. But there were also a number of other settings that we used, so the Gagwara, but also some of the organisations were trying things in some of the food banks and food pantries, and out and about. I think there was plans for one in a supermarket kind of just outside of that. So trying a whole range of different things to see what worked and what didn't. So in total, over that 3-month period, there were just over 1,100 blood pressure checks that were taken. The average acceptance rate was 77.6%. But as I just said, that did vary quite a lot depending on the venue and setting. So there was a bit of learning in there around if it was a venue where people wouldn't normally be expecting to engage with health related stuff, there's maybe a bit of you needing to be there more frequently and more visible, spending longer, getting those relationships built up. It was predominantly women, so whilst men were a real target group for this, because women generally tend to come forward more to have their blood pressure taken, it did still tilt heavily towards women in terms of the percentage of people that got their blood pressure checked, but a third were men. And in terms of the other demographics, one of the target areas was Black men. There were small numbers of Black men that engaged with this, but the majority, as you can see for the figures, were white or from Indian ethnicity. And the most common age group was that older age group. In terms of trying to reach those people in community settings that might not otherwise come forward to have their blood pressure taken, then what we found was about a third of people hadn't had their blood pressure checked within the last 12 months. 2/3 had. Some of the feedback that we got from partners is that there were people who had their own blood pressure machines at home and were checking regularly, but they didn't necessarily know what the numbers meant or when to be concerned. So there were some people that they came across who had consistently very high blood pressure readings, but because they were consistent, they weren't reporting them or raising it with anybody. And then in terms of the spread of blood pressure readings, most were in that normal or normal but elevated range. But there were a kind of a decent sized group that fit into that high group, and then a smaller number that were extremely high. And as I say, we did quite a lot of work, public health, on the pathways for referral and where people should go next. So there were more people that were pushed towards community pharmacy rather than into GPs. I think I've covered most of the learning on this one, so I'm not going to dwell on it. But what I did want to just briefly mention is that this year, there is a programme that is a Leeds-wide programme that is focused on cardiovascular health and hypertension, and there is a target across the city of getting 5,000 blood pressure checks done, and really again trying to target those people and communities that might not be having their blood pressure checked. So this has been a really great short-term piece of work to look at what the community input might be to this type of project. Rachel, I think you're going to take over for a bit again.
Yeah, cheers. So yeah, just looking in terms of some of the regular sessions that we have for LCP partners to engage with. So they range from lunch and learn, similar to this, online. For example, in the past, we've had domestic violence and abuse and support for men. It might be a learning forum where we bring partners together to learn about a topic, share best practice, for example, winter wellbeing, community engagement. But in the last quarter, we did something a little different and called a conversation around transport. So this was about understanding that transport can be a real problem, both in terms of people getting to health appointments, but also helping people access activities that can support health and social connections. We know that's more of an issue in some parts of the city rather than in others. So we held this event for partners to come together, discuss and share their challenges, but also where partners have found solutions or partial solutions to this. So really the ethos that we can share sort of ideas, understand the challenges, but understand sort of the impact that transport has on people's access to health and care activities. So this was a really interesting session with a lot of learning taken away from partners who are already doing great stuff. For example, we heard from Otley Action for Older People, sort of sharing their transport offer. Shout out to Crossgates Good Neighbours. They shared their information about their transport scheme. We had Leeds Older People's Forum sharing the Travel with Confidence project. And then we had West Yorkshire Combined Authority, were in the room as well with us, so sharing solutions that people might not be aware of, but also taking that role of listening to people's challenges. So really some of the feedback was that partners went away with new knowledge, new contacts to follow up outside of that room, but the opportunity to continue to connect with WYCA, West Yorkshire Combined Authority. But we're always exploring new topics and new ways for partners to come together from across the different LCPs. So if you do have an idea, you want to call a conversation on something, we'd love to hear from you. Yeah, so sneak preview, what's coming up next on the dashboard, which is about to be released very shortly. So this is shining a light on Team Morley, so Morley LCP. So we've got areas of focus across all of our LCPs and they're all moving forward. And this is a priority that was identified very much sort of bottom up. So from local partners, in terms of what they were hearing, what they were seeing in practice, around alcohol and drug misuse. So a little bit of a summary has been pulled together really in terms of what's going to be happening. But this is all with strong support from Forward Leeds. So there's some opportunities here to provide training for workforce from all sectors, really how to work with local people, how to have positive conversations around these topics, and sort of successfully connect them with Forward Leeds as appropriate. Also around information sharing around where to seek help and support. And then a really interesting bit, sort of going to where people are, so that community engagement, sort of raising awareness and that education piece. So this is just another example of things that we're doing in LCPs. Again, we can test and learn here and potentially share with other areas across the city as well.
Sorry, I'm all over the place with the eagerness to move on slides today, right?
Very fine.
So I said that I would talk a little bit about neighbourhood health. I'm not going to go into this absolutely tons today. What we are going to do is over the next month or two, come out to different local care partnerships and have a conversation with you there where we've got much more time to engage and have a conversation about what might happen here. But as part of the government 10-year plan, they've really reinforced that they want to see neighbourhood health as something that is at the core of how we support people around their health. And we've got kind of 3 different diagrams sat on this side, which I will really quickly run through. So they describe within that national document 6 key components that help to support neighbourhood health services. So some of that is around the modernising general practice agenda. There is a bit around making sure that the community services that we provide are standardised. So there's a kind of consistent base service in the way that we deliver things that people can expect, and that we are using data effectively and coming together at a neighbourhood level to support people. So those are your kind of 6 core components. There's then this little diagram with the blue bubble in the middle that kind of tries to capture what people can expect in the next 5 to 10 years around how their health is supported in their neighbourhood. So that big outer circle that says connecting people, that is basically the bit that we are saying this is what everybody can expect. So it's around having those really good connections between all of those services that support not just health but well-being. So not unlike some of the stuff that we've been describing within that York Road non-clinical model, that we're thinking about people's wider well-being, that we're looking at those opportunities to provide a number of different services under one roof where it makes sense to do that, and that those are nice and accessible within your area that you live in, and that that's what you can expect. So that is something that you'd expect to benefit everybody. There's then in that kind of next circle in strengthening primary and community-based care, enabling more people to be supported closer to home. So this might impact on all of us at some point, but this is much more when you're starting to need services and intervention, and that is thinking about what are the things that can be brought to you rather than you're needing to go to lots of different hospitals or clinics or different appointments all over the place, and it doesn't feel like one professional's having a conversation with another, so you're having to repeat your story. How do we make sure that people work together as effectively as they can, and that where it makes sense is delivered in local settings in the same way as people would go to their local GP? The bit that we'll probably focus on a little bit more in local care partnerships, and you'll start to hear a lot more about, is then this blue bubble in the middle that says NHS and social care working together to prevent people spending unnecessary time in hospital and care homes. There's various different ways that this is described, but around about 3 to 5% of our population have got really quite complex health needs. A lot of those people are also frail elderly, but not all of them. But these are the people who are having multiple interventions, might be in and out of hospital. They're exactly the sort of people that we are designing things like the Advanced Respiratory Project, like the Falls work in York Road around, and making sure that people have got really great joined up care, and that more and more neighbourhood services are working really effectively together to make that happen, but also are then connecting with those specialists and consultants in the hospitals and feel like they are colleagues that are working alongside them in a team leads approach, rather than we're pushing referrals around a system. We don't know each other. We're not necessarily sure what happens with that referral. So that's where we're going to see a lot of focus and concentration around some of that neighbourhood health work. For people that have been attached to local care partnerships for as long as Rachel and I, which is just before the pandemic, you might remember that we did a piece of work called Population Health Management, where every single local care partnership got their data about their frail population and understood what makes our frail population different to the rest of the population in Leeds, and where should we be focusing our effort and energy. So in that last diagram that you can see that says neighbourhood health in Leeds, there's going to be a piece of work that's captured in that greyish blue bubble at the top that says Home First Phase 2 Proactive Care, which is around, once again, each area understanding the things around their population that they should be proactively working on together, and bringing health and care professionals, third sector, all those other partners together to think, how do we better support those individuals? And what we're saying in Leeds is our focus this year in terms of how we continue to develop and mature neighbourhood health, particularly for those people in that inner block box, the more complex people, that's going to be the focus of how we do it. And in doing that, we build and strengthen our relationships. We start to do some of those other things that fit in with the 6 core components. You'll notice there's some other bubbles sat in that final diagram. One of them is around the community mental health transformation that's been going on for a little while. And if you are connected to a local care partnership, you'll have had the transformation team come and talk to your local care partnership about what that means for you and what you can expect to happen. There is the hypertension work that is the bit that I just very briefly mentioned when I was talking about the work in South and West. And then there is a piece of work around children and young people, which we think for the first year, because it is starting with the most complex people, won't necessarily have a geographical focus, that it might be across City One, but that will eventually kind of distill down into that, again, focus on how do we support people where they live. So connected in with those things, we will be having conversations with each of you in terms of different local care partnerships around what that means for you. But there's also some local care partnerships that are getting on the front foot with some of this. So they've looked at what the priorities are, looked at how it fits with some of their data and figures, and are starting to have conversations on this. So again, in terms of what's coming up, we just wanted to flag that I think it might even be next week. LS25-26 in their next local care partnership meeting. They'll be continuing on some conversations around some of the areas that they might want to focus on around obesity and hypertension, learning from the work that we've been doing in the other areas and thinking, what could we do locally and how would that fit with this year's priority? So that is us. I'm going to stop sharing and we will open up to you if there is any questions. And we'll also stop recording at this point too, so that if there's anybody who doesn't really want to be captured on a recording asking questions, you're not put off by that.